Good afternoon, everyone. Welcome to my page, Dr. Rekha Sehgal, Homeopathy for Mankind. First of all, a big thank you to everyone for supporting my videos. Well, today I am discussing a very important topic which I think that everyone is getting in their clinical practice is insomnia or loss of sleep. Now, what is this insomnia? Insomnia is a condition when the patient is unable to get sleep or falling asleep. It could be acute insomnia when the patient is not getting sleep from past 1 day or 2 days, or it could be chronic one when the patient is not having a sleep from past many months. So there are two types of insomnia. First one is the primary, and the second one is the secondary. In primary insomnia, usually you while taking a case taking, you will find that there is no health related condition is there. It could be phasic one. So you have to dig out the causative or ailment factor in this condition, that why the patient is not getting the sleep. It could be the sedentary lifestyle, or the change of job, or he is on a sometimes the patient can say that because I have to travel somewhere, I'm not able to getting the sleep, or stress factor in his or her life. That could be the loss of loved ones, loss of a job, or shifting of a new to a new venture. So these are the conditions which are very basic one, and there is no health related condition associated with it. The secondary one, insomnia, is a condition or chronic one where the patient could have an history of any kind of medications like blood pressure, or in steroids, or asthma. Drugs could cause insomnia in a long run. Or there is a certain disorders like hyperthyroidism, sometimes diabetes, because of which the patient is unable to get sleep. Or there could be a certain mental health problems, that is anxiety, depressions, bipolar disorders, schizophrenia. These are the conditions where the patient could come to you and have a history of not getting sleep from past 2 months or 3 months. So being an homeopath, our duty is to dig out the main ailment factor or causative factor, that why the patient is not getting the sleep, because then you will be able to categorize it whether it is an acute episode or a chronic episode, and hence your case taking will be dependent upon that. You can say dependent upon it. Now, the therapeutic indications, as you all know, I always discuss some of the remedies which I find in my clinical practice are very helpful, and I want to share with them. But for a proper cure of this problem, you have to take a proper case taking of the patient. You have to dig out the problem at the level of the mental, or it could be at the level of the physical, and then you can reach to the similar number. Now, what could be the therapeutic indications for this problem? The first remedy which I am going to talk is an acute, very acute remedy, that is aconite. As you all know, this remedy is prescribed in a patient when the patient gives you a history of insomnia from past 1 or 2 days, that he or she is not getting the sleep. When you inquire, the patient will always give you the details that there is a causative factor, could be of an overexcitement, or could be any fear factor in his life, or could be any stress factor, and the patient is keep on tossing in the bed at the night, and they could have anxious dream also. So dream is a very important part in the sleep, which I think need to be discussed separately. So there are today I'll be emphasizing on only the sleep patterns. The second remedy is which I want to discuss is the Nux vomica. This is the remedy which I have prescribed in many cases after post COVID period, because I feel that because of COVID also the people are jumped into a lot of sedentary lifestyle. They are doing their jobs in the home also, and there's no pattern of eating, drinking, or sleeping. So this condition could be for the patients, those who are indulged in a lot of sedentary habits, when you inquire about the eating patterns, there is a lot of indulgence of stimulants like coffee, alcohol, and plus the patient is always engrossed in the mental work. And the patient in this kind of this the patient will be having a sleep till 3 a.m. and after 3 a.m. the patient is not able to get sleep. And when you inquire, he will always say that after 3 I'm not having a sleep, and when I get up in the morning I'm not refreshed, and they are always better by a small sleep or small nap. They are always better. The third remedy is gelsemium. This remedy is prescribed in cases where you get a history of where there is a emotional excitement is there, that unexpected bad news or something fear or any fright factor is there. And with this the patient will be having a lot of dullness and drowsiness. And when you inquire about another entries of the gelsemium, then you will be the patient is very dull, drowsy, and always wants to sleep, but he or she is not getting the sleep. The fourth remedy is Califos, which is a very good remedy for the females. It is prescribed in cases where the female is engrossed in a lot of household chores. The mentally, they are also very much occupied. They are overburdened with a lot of duties, and because of over responsibilities, they are unable to get a sleep properly. So this remedy is very beneficial for the females, and I always prescribe in biochemic form. 6x or 12x is very beneficial. The next remedy is Avena sativa. This is prescribed in mother tincture form. This is the remedy which is given for the cases where you get a history of depression, or the nervous temperament is there, a lot of anxiety issues are there. So this remedy soothes the nervous system, and when the patient while prescribing this remedy, you will find that the patient will give you this feedback that after taking this medicine, usually I prescribe at the bedtime 20 drops, the patient will have a very refreshed and very good sleep. So this is kind of a nerve tonic. The next remedy is Imbra Gracia. This is a friendly remedy for all the old age people, because of which they are not having a sleep. And I have prescribed in cases where the old people are not having a sleep, they are unable to get sleep, and they are waking up all the night. There could be some conditions of pain where because of which the dental troubles or teething troubles in children, some medications are involved like Sina, Chamomilla, Simsifuga. They are really very good results in these cases of insomnia. So these are some of the medicines which could be given in cases of insomnia, but with a caution, you have to dig out the symptoms in a proper and form the totality at the level of the mind or at the level of the physicals, because I feel that the mind is important as well as the expression of mind in the forms of physical is also very important. So you have to give a lot of attention to the physicals also. And you have to make an alignment of mentals and physicals, and it will give you a simulum in a very short span of time. Now, what could be the lifestyle modification, which I always give in the end, because I feel that we as a homeopath believe in a holistic healing. So this lifestyle modification is must for everyone, and they always boost up your prescriptions. So first is that you have to insist your patients to have a proper sleeping patterns, a fixed sleeping patterns, to get up early in the morning, and as it is possible, lay down in the bed at night by 9 or 10, or avoid any kind of stimulants like tea, coffee, in the late hours, they are really they wake up your nervous system, and you will have a difficulty in getting the sleep. And then deep breathing exercise, as I always say, relaxation technique, yoga, meditation, these are all multifaceted things which I think that they have given a very good results in your in my clinical practice. And avoid heavy meals in the night. Always advise your patients to have a lighter meal in the night. So I think that I have tried my level best to cover this topic. If you have any inquiry or if you have any queries, you can write it in the comment box. I read your comments. It is very beneficial for us also in expanding our knowledge, because today's scenario is that the more you will share, the more you will get. And if you have any query related to this, you can ping me on my mobile number, WhatsApp number also. I hope this video is beneficial to you. I'll be posting more videos in the future, and so enjoy homeopathy, love homeopathy, and grow homeopathy. That is the need of the hour. Thank you, and have a very nice day. Thank you.